We're going to talk about health professionals on the scene. I think this is a topic that comes up from time to time of how do you interact with a physician that's on the scene of a motor vehicular collision, a sick patient, etc., or another paramedic. So I think that's something that needs to be addressed, and I'm going to talk first about the physician on the scene. Um, our state protocols and our state guidelines, operational guidelines, basically um, would be that a physician on the scene, either they've stopped, you know, they're there when you get there, or they've stopped while you're there. Always treat them with the professional courtesy. It's totally within your right to ask them to identify themselves and produce um, identification outlining their qualifications. Um, you still, even though they may want you to do something that's outside of your scope of practice, you don't do anything that's outside of your scope of practice. Now you can give them your drug box, you can give them your equipment, because they may want to do something that's in their scope of practice that's not in yours, but don't do anything outside your scope of practice. Uh, and then it goes back to, well, do these physicians have to write in with these patients? And I think that depends. I think if they have basically not done any advanced procedures that's outside of your scope of practice, then I think they can certainly let you transport that patient. I think that if they've done something, they've done a surgical crike, they've done something that you normally don't do, then I think it's perfectly within your right to ask that physician to write in. And always just talk with med control, call med control, and I would suggest calling them on every one of these patients and let them know that there's a physician on the scene. Um, it may be a physician that's not very comfortable or very versed on trauma. It may be what have you. It may be a neurologist or an OBGYN doctor, etc., that may not be very versed on trauma. They are a physician, so it's important that you keep med control in the loop. And many times, med control can actually talk to that physician um, and keep you out of the middle. So always treat the physicians with and paramedics as well that show up on the scene, but treat them with professional courtesy. Um, and you don't necessarily have to have them write in unless they've done something that's outside of your scope of practice. That dovetails into, what about going into a physician's office? I think if you go into a physician's office and they've called you there to transport that patient, many times that physician is going to defer to you anyway. They have exceeded what they can do, and they want you to transport the patient. But many times the patient doctor will still want to give you orders, and again, I think that's fine as long as you're not operating outside of your scope of practice. Many times I still encourage calling med control, let them know, keep them in the loop, and it keeps you out of the middle. What about paramedics on the scene? I think that's, we probably see more paramedics and EMS personnel that stop on car wrecks, etc., or medical patients than we do physicians. But when they're there, treat them with professional courtesy as well. And many times these people. There's nothing wrong with allowing them to assist you with your treatment of that patient. Now, sometimes you get into a situation in which you may have an on-duty personnel that says, no, I don't need your help. And at that point in time, if you're an off-duty personnel and you have arrived on the scene, then you really should not force your way into the treatment of that patient. But as long as that treating paramedic or treating EMS personnel is asking you or is okaying you to help, I think that's perfectly fine to continue helping them and assisting them. They may not want you to assist with invasive procedures. They may want to do those just because of the liability from their service, but the basic life support, that is perfectly fine. And again, I can't stress enough calling medical control and talking with them about the situation. Many times, if you call med control, they can sort of be a mediator and keep you out of the middle.